Hello, I'm Dr. Dennis McKenna. I'm joined today by Dr. Jason Mazakis. Jason, it's great to have you here.
Great to be here.
All right, we're going to talk in just a couple moments. Today is Tuesday, November 14th, giving you the update from Albany Med. There's an announcement that we need to make here today. Dr. Peter Page, our hospital general director, has announced that he's going to be taking a job down in Virginia. Dr. Page has been here just shy of 2 years. I just want to say I think Dr. Page has done a great job in that role, and we appreciate all the time he spent here and the leadership that he brought to that role. Now, his last day is December 8th, and obviously we need to find a leader who will run the hospital. We went through a process of looking for who the best person would be to step into that role, and I'm very pleased to announce Dr. Jason Mazakis, you will be our interim hospital general director, and obviously I think you have all the remarkable skills to do that, so congratulations, and thank you very much. I appreciate that.
Thank you, Dennis. I am absolutely honored to take on this role. Thank you.
For people who are in the audience, I think many people know who you are, probably most, but there may be some where we can go back a little bit and talk about you and your journey here at Albany Med. First of all, I'll start by saying I'm wearing the Children's Hospital sweatshirt here today in your honor. Dr. Mazakis is an otolaryngology surgeon, ear, nose, and throat surgeon. And specifically, the area that he focuses on is children. So I wore this today in your honor because I know there's probably tens of thousands of children that you've treated over the years as a surgeon, and I wore this in your honor today.
I appreciate that, Dennis. It means a lot to me. It's been a really great run in clinical practice in the Capital Region, taking care of so many of these deserving kids.
Yeah. You and I share a lot in common, so let's go back. I am a graduate of Albany Medical College, as are you. What years were you on this campus?
Well, so I remember it'll be 36 years in January of this year that I walked this campus at, I think it was 6 in the morning. My dad is an early riser, wanted me bright and early for my interview. Was able to matriculate at Union College and the Albany Med program. So on campus from 91 to 95 for medical school.
And then after 95, that's probably when we first started to meet each other, because then you went on to train for surgery as an ENT surgeon here on this campus in residency as well. I was training in emergency medicine at the time. Interestingly, I think Dr. Boulos was training in neurosurgery at the time.
That's right.
So it all comes together. Talk about your time. How many years were you a resident here on the campus?
So from 95 to 2000, I was first a general surgery resident for 1 year.
Right.
And then, as Dr. McKenna alluded to, we crossed paths probably in many shared patients in the ED,
right.
and eventually when you became an ED attending, and I stayed on through the year 2000 as an otolaryngologist resident.
And you were in what at the time was the division of otolaryngology.
That's right.
And just to fast forward, that was a group that was employed by the medical center for a period of time. It went out and was private and then got brought in to the faculty practice here. And importantly, you served a very important role as the division lead in otolaryngology, taking them from division status to departmental status. And I know you would give credit to a lot of people who helped that happen, but talk about what that meant to take it to departmental status.
Well, it was an amazing journey. We started with 5 of us, 5 core faculty, and I do want to mention Dr. Steve Parnes for being a thoughtful leader, member of our board, tremendous influence on my career, and really taking our faculty and taking this group of initial 5, growing it to over 23 when we became a department a little over 2 years ago.
It's a remarkable story, leadership on your part, and of course you mentioned Dr. Parnes. I would absolutely throw credit his way as well, and deservedly so. When we thought about what type of skills we need to be the person who runs the hospital, the title we call our hospital general director, let me articulate the reasons why we settled on you, Dr. Mazakis. First of all, an incredible surgeon, right? An incredible surgeon.
I appreciate that.
Somebody who has demonstrated significant leadership in the perioperative space, obviously. You were very quick to adopt the electronic medical record, and you've been a leader when it comes to advocating for us to move ahead with the EMR here. In addition to that, as a health system, you've been very quick to reach out to the other otolaryngologists in the system, as well as the other surgeons, to say, how can we work more closely together? And I would also add, you also have clinical privileges up at Saratoga Hospital as well,
That's right.
Correct?
And I think Dr. McKenna is alluding to the importance of clinical integration in our system. This is an absolute priority. This will really bring us together as a huge team in the Albany Med Health system. So I really look forward to that development.
And in the faculty practice where you're currently a chair, you've also been an early supporter and advocate of the Patient Engagement Center. And in addition to that, you've obviously been someone who's been very focused on increasing access. Moving that into the hospital role, it's obviously a different area, but I know that you're going to be a fierce advocate of increasing access in the hospital as well.
this has to be an important priority for us as a system. The main priority is patient experience, and that starts with gaining access for our patients to get into the system, to see the right physician at the right location at the right time.
Right. Now, before we move on, working at Albany Med is a family affair for you as well. I think there's somebody else that you'd like to mention who works here at Albany Med.
Absolutely. My lovely wife, the academic director for the School of Nurse Anesthesia. She's a CRNA, and the nurse anesthetists are really incredibly helpful for our delivery of care in the peri-op sphere. And I'm lucky to have a nurse as a wife. She really grounds me, and I understand so much about healthcare, not only from her career background, but she also has her doctorate in bioethics.
Yes.
So she keeps me on my toes.
Yeah, we thank Amy because we know that we're going to be asking even more of Jason in the future in this new role. And obviously we thank her for everything she does all the time in the OR, in our education space. And she's a great advocate and voice for us in the community as well. So once again, I want to congratulate you. I really look forward to working with you in this new role. We've obviously worked together in many other areas in the past. Absolutely a spectacular choice. We announced it, and people are very excited to see you hit the ground running.
I am beyond excited to be on this team.
Good.
And
Good.
excited to be a part of Albany Med's awesome future.
No, very good. Let's change gears and talk about Veterans Day. We had Veterans Day just late last week. I want to thank the volunteers, including the volunteer office, who allow us to do what we do every year. We run a list of individuals who are in the hospital, usually in bedded units, sometimes in the emergency department, who are designated as a veteran in their medical record. And we give them a small flag as a token of our thanks and a little thank you card. And we usually have individuals who help us do that. I know this year there were many who came forward, including some medical students. I always do it with Dr. Kurt Edwards, who's also a veteran. And we do that, and it was wonderful. And I believe your father's also a veteran.
And thank you for your
Thank
service.
you. Yeah.
Yeah, my dad and my granddad was also in the Navy, so we've got a Navy tradition.
An important history with your grandfather.
That's right. He was on one of the landing craft that returned with MacArthur in the Philippines, and we just a week or two ago discovered one of his journals, and he actually commented on the end of the war, and just seeing it visibly written by a young man, and the words, "Thank God it's over." And it really struck me. You know, the greatest generation and the service to this country. We really appreciate our veterans.
Absolutely. And thank you to our workforce members who are veterans. And again, thank you to those who made it a special day for those in the hospital. Jason, one thing that we want to encourage our workforce to do is I sent out the monthly letter. For those who perhaps have not seen it, you can go to the intranet tab. There's an area come from the CEO, and our letters are there. This letter this month talked about the adjustment that we're making to salaries with the bring to minimum. We're bringing it from $15 an hour to $18 an hour. That's a very significant investment in our workforce, but something we're very privileged to do, we're very proud to do, and we know that many are going to benefit from that. In addition to that, based on years of service and the jobs that different individuals have, we know upwards of 6,000 people are going to get an adjustment in their salaries. I just want to say again, this is something that we felt was the right thing to do and something we're very proud to do. And I encourage you to take a look for that letter. On the bottom of that letter, you will also see some QR codes. One of them lists what we call our benefits, and another is some information on the referral bonus program, because we know our workforce can be our best ambassadors, and ultimately if they can refer people into Albany Med and we hire them here, then obviously there would be a referral bonus. It's part of our retain, recruit, retain strategy.
Absolutely, and I think this is tremendous. The workforce is absolutely our lifeblood.
Yeah, and again, it's something that we're very proud to do. We were very proud to announce it. And it's something that we know ultimately is the right thing to do for the people who, quite frankly, allow us to do the mission every single day. The last thing I'll say is we're coming up on that time of the year where we will be announcing our Employee of the Year. The good news is if you work with somebody that you think should be the Employee of the Year, you still have time. This video will come out on Tuesday. We will accept nominations till close of business on Wednesday. And Bree Caban is our current Employee of the Year. She's an emergency room nurse, and I show her every week at our new employee orientation how she embodies compassion, accountability, respect, and engagement. Encourage you, if you have someone to nominate, please do so. And we really work with such amazing people.
It's the people that really makes the Albany Med experience special. And I particularly look forward to the CCLM monthly meeting when we announce the winner. It's a tremendous opportunity.
It is a tremendous opportunity. All right, Jason, thanks for being here.
Thank you, Dennis.
Congratulations again.
Appreciate it. Looking forward to many great years ahead.
Well, I appreciate you stepping into this very important leadership role.
Thank you.
All right. We'll be back again in 2 weeks. We thank all of you who are working now harder, more than ever, and we ask that you once again please take care of yourself, take care of each other, and we'll see you in 2 weeks.